Now we're going to use the idea that it's a non-physiologic torsion. It's a posterior torsion, or a backward torsion as some people will refer it to. Okay? These don't typically occur during our normal walking cycle. These typically occur during picking up things off the floor or lifting things off. There's a reason I do the things I do. Sometimes. Okay? So, in this example, we're going to say with the same thing that it's a positive seated flexion test on the right. Okay? Positive seated flexion test on the right. This thumb rides high. Okay? We're going to say that the sacral rock test is also what? Abnormal. Doesn't feel quite right. Doesn't feel smooth and symmetric. It doesn't move the way it's supposed to. It's positive as well. We check our four corners test. This time, these superior poles here, this right pole seems to be shallow relative to the other pole, which seems to be deep in comparison. This inferior pole, this seems to be relatively anterior, while this one seems to be relatively posterior. Okay? The ILAs, again, may or may not be a little bit unleveling. That's not the biggest factor, so don't pay too much attention to that at this point. Okay. The person comes up on their elbows for the Sphinx test. Sphinx test is what? Better or worse? The asymmetry is better or worse? Worse. The reason being is because this corner is held posteriorly. So when they come up on their elbows, which should be able to then, it should move freely forward, this is already held posteriorly. It can't move forward. It's going to stay where it's at. This corner is okay to move forward. It moves forward more. So now you have what? A more obvious amount of asymmetry. Okay? So Sphinx test is positive. You have an increased asymmetry. Alright? So increased asymmetry in a Sphinx test lets you know that you got some sort of posterior something. Whether it be a torsion or whether it be like a unilateral extension. Okay? That kind of thing. Alright. We go up and we check. Let me just put this in here to show you. This is the axis again. Right? We've got a left axis. Right? It's a side opposite the positive seated flexion test. Except now, which way is this thing rotated? This top corner is what? Shallow. If we were going on a vertical axis, it would be just rotated right. Okay? So it's a right rotation around a... So we say it's an R on L. It's a right on left. Right rotation on a left axis. Right rotation on a left axis. When we name these things, it's always important for you to understand that they describe the rotation before they describe the axis. Because that can make the difference between getting a question right or wrong. Is if you have it flip-flopped, you're going to be thinking the wrong thing perhaps. If they're different letters. Okay? Alright. So, what would we expect of L5? Neutral or non-neutral? Neutral or non-neutral? For a forward torsion or a physiologic torsion, we said that we would expect it academically to be neutral. Well, this is the opposite, so therefore we'd expect it to be non-neutral. Alright? Non-neutral. The side bending component would be expected to be which? Side bent left. The side bending determines what? The axis. The side bending determines the axis. Whether it's anterior or posterior, if it's a left axis, we would expect L5 to be side bent to the left. The side bending determines what? Say it again. Side bending determines the axis. So if it's side bent left, it's non-neutral. What would we expect the rotation to be relative to the sacrum? To the left. To the same side as the side bending. So we would expect it to be non-neutral. We would expect it to be rotated left, side bent left. Okay? So whether it's flexed or extended. What kind of Friat mechanics? Type 2. With a physiologic or anterior or forward torsion, what type of Friat mechanics? I would remember that. That's an important thing, academically. Type 1 lumbar with a physiologic torsion. Type 2 lumbar with a non-physiologic torsion. Okay? Why is it type 2? Because it's non-neutral. Side bending and rotation are to the same side. Okay? Does that understand the relationship? How did I get this? Oh! Oh! Non-physiologic movement. Forward bent, sacrum didn't do what it was supposed to do. I come back up and it's like, oh! It's stuck posteriorly. Okay? Everybody's got it?